And we are so glad to have you with us tonight for so many reasons, all of which will become clear as we talk to you further tonight about this really incredibly important issue of COVID and its impact on the Black community. With me tonight are Gwen Gregory, who is the Director of Nursing at the Lucas County Health Department, and David Ross. All of you know David. He is a well-known voice in this community, really strong in the community of artists out there, and definitely an influencer in our community. So before we get started, I want to suggest that if you have questions, that you go to the Lucas County Health Department's Facebook page. We're also going to be posting this on the County Commissioner's page as well. So listen, we are going to talk to you tonight about something that's so important for you to know about. And this is the first of a series of conversations that we plan to present to the community around the broad impact of COVID on the way we live our lives, not just our health, but the economic impact, the housing impact. All of those things are important as we talk about COVID, and we're going to be talking about those things over the next several weeks. So we hope that you will join us. We'll give you more information about upcoming conversations before we leave you tonight. This series of conversations was put together by a huge group of people, lots of voices. Doesn't matter so much who they were in the process, it just matters that they were in the process. But we can't go another step without a huge shout out to Katie Crosby. This would not have happened without her leadership. It got done very quickly, and we absolutely owe a significant debt of gratitude to Katie for getting this done. Thanks, Katie, wherever you are out there. So I want to talk to you about this issue of COVID-19. We have numbers for you tonight. We have stories for you. We've got reasons why this thing happens. All of that we have for you this evening. But this is what I want you to keep in mind. No matter how dire the circumstances appear, no matter how often you hear that we are dying in significant numbers, I want you to remember that if you are Black, if you are brown, if you are poor, if you are a woman, you have always been a warrior. You have always had to fight. This is not the time to stop. There are things that you can do. There are ways that you can protect yourself. And it's important that you listen to us and you do those things. For those of you who hear us go through this conversation and you say, there they go again. They're talking about race. They're making this conversation about race. I would say to you, you know what, you're right. Because although there are lots of reasons why we are in the position that we are in with COVID and our communities, the reasons for those whys are founded solidly in race and class. So buckle up. We're going to talk to you tonight about this issue in a real way, in a way that you can understand it, and hopefully in a way that you take with you when you leave us tonight. I'd like to introduce you to Mr. David Ross.
How you guys doing? How you doing? I'm David Ross. I work for the Toledo Arts Commission, and I do a lot of activism and community involvement. I represent pretty much anyone who is passionate about community, passionate about youth, and this issue is serious in our community, and we cannot avoid the fact that it's affecting us directly. One of the things that we would like to do is, like she said, make it about race in a negative way, but this is in a way where attention needs to be brought about because we are losing elders, we're losing family, all of these different people being affected by it, and it trickles down to everyone. So us as a community need to lift each other up and bring light on the seriousness of this subject. And the biggest part of it is being misinformed. So right now we're going to attempt to pretty much fill in some of those dots and make everything so everyone feels the comfort, because that's what's important right now, being comfortable and getting past the fear and moving forward.
Ms. Gregory.
Good evening, and thank you for having me. My name is Gwen Gregory. I am the Director of Nursing at the Toledo-Lucas County Health Department, and I'd like to bring awareness to our community, awareness that will help empower each individual with knowledge, with facts, not with myths, that will help us to combat this awful disease, this pandemic that we're in, without panicking, with trusting our leadership and our professionals that are guiding us correctly.
Thank you. Thank you so much. We're going to start out with an overview of just how difficult this problem is in Lucas County. So I'm going to ask that we put up some slides that show exactly what our situation is in Lucas County. While that is happening, I'm going to talk to you about a few other numbers that will really make you understand exactly where we are with this situation. In Michigan, for instance, and in Illinois, African Americans are 15% of the population, but 40% of those with corona. That's a staggering number. In Louisiana, where African Americans are 32% of the population, they are 70% of those with the virus. Black men die on an average of 6 times earlier than white men prior to the coronavirus. Let's take a look at the numbers for Lucas County by race. 248 cases at this point. I'm sorry, I can't see those numbers.
343. Oh, no.
Yeah, David, would you read those? I can't get them. I can't see those.
In Lucas County, count by race, 180 are white, 297 are Black, 23 are other, and 108 are unreported by race.
All right. Would you read the next slide as well?
So for ethnicity, 321 non-Hispanic Latino, 24 are Hispanic Latino, and 263 are unreported.
Right. And I think there's one other slide we'd like you to take a look at.
Lucas County.
There you go. There you go. The Lucas County death count by race, David.
15 are white, 10 are Black, 1 are other, and 2 are unreported.
So no matter how you look at these numbers, they are devastating to our community. They happen for a number of reasons. We're going to talk about the reasons why they happen. But before we do that, Ms. Gregory, would you lead us through a conversation about the symptoms? What should people be looking for? How does this affect the body?
Absolutely. Now, there's a wide variety of symptoms with coronavirus. There are common symptoms, and then there are other symptoms. So let's just start with the common symptoms. The common symptoms involve fever, generally a temperature of 100.4 degrees Fahrenheit or higher, a dry cough, fatigue, unusual fatigue, shortness of breath, chills, headache. Others have experienced a new loss of taste or smell. And that's very important because we've been seeing a lot of positive patients, and the only thing they may have encountered is a new loss of taste or smell. So pay attention to that. Other symptoms include muscle aches and pains, unusual muscle aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. People with mild symptoms who are otherwise healthy should self-isolate. And what I mean by that is if you are having a dry cough or if you have a fever, you should isolate yourself for 14 days so that you're not around anyone else if you are otherwise healthy. Also, I'd like to keep in mind with African Americans, we also are disproportionately affected by many diseases genetically, such as high blood pressure, diabetes, stroke, and obesity. When you already have those conditions occurring, you are already at a higher risk and a lower immunity than most people. So you have to be careful with that. Another thing I'd like to inject here, medications, over-the-counter medications. You may have heard the word NSAID, NSAIDs. That stands for non-steroidal inflammatory drugs. Those are your aspirins, your Motrin, your Advil, your ibuprofen. Those drugs can hurt you with high blood pressure. What it does is it places an increased risk on your heart and your kidneys. So if you need a over-the-counter pain medication and you have high blood pressure, I would suggest Tylenol, which is acetaminophen. You have to be careful with mixing even over-the-counter drugs with certain conditions. Obesity, everyone that's obese, especially us, especially African Americans, we are at a higher risk of other conditions because we are working our organs and our hearts harder because of the extra weight.
You know, I don't think that we recognize as a community, Gwen, the peril that we are actually in. I was listening to Van Johnson the other day on CNN, and he said one of the reasons that this is so devastated to our community is because we are laying this pandemic over a number of issues that already impact our community. Like, I don't know that we really understand in our community that 42% of men and 42% of Black women have high blood pressure. We get it earlier. It stays with us longer. We have difficulty controlling that blood pressure. 60% diabetes is often found in African Americans, 60% more than it is in other folks. And just all of the diseases that this community encounters, we find in greater numbers than we find in the community in general. So that really puts us at a much greater risk.
Absolutely. Absolutely, because we're already starting behind the line with those chronic conditions, with those underlying conditions. There's so many undiagnosed hypertensive patients out here in our community. And unfortunately, sometimes it happens after a stroke that you realize that you even had high blood pressure or a heart attack after the fact.
Right. There are things that we can do, though, to get those things under control. And I know people have heard this a million times, but the reality is that if we don't get these things under control, even after COVID is under control, we will still see our community dying sooner than it should, Black men leaving sooner than they should, and being a sicker community than we need to be.
Correct. And there are things that we can do as a culture that don't cost a dime. Walking 15 minutes a day consistently without stopping, just 15 minutes will lower your blood pressure and your blood sugar. Just walking, just taking a walk around the neighborhood, 15 minutes without stopping. It doesn't have to be a real fast pace, just as long as it's consistent. If you do that every day, that will lower your blood sugar and your blood pressure. Drinking water, 64 ounces of water sounds like a lot, but it really isn't.
Right.
If you drink 64 ounces of water a day, that will lower your blood pressure. That will help your kidneys function.
Right. And all of this is important, you guys, because these are tools that you have to help you win this fight. These are tools that you have, I'm going to say it again, to help you win this fight. When some of the things that they're telling us to social distance, they're telling us a list of things that we can do to stay safe. Would you remind us what those are?
Absolutely. So it is very important to social distance yourself with a minimum of 6 feet apart from the next person. We have shown how that social distancing has flattened the curve, how effective that is. Also, if you have to cough, please cough in your forearm. Cover your mouth. If you don't have a professional mask, just a regular cotton cloth, a scarf. Cover your nose and your mouth when you're out in public. Those are things that you need to do. And stay home.
Stay
If you
home if you
don't need to
can.
go out, stay home. Number one, number one, number one, hand washing. Let's not get complacent and forget about good old fashioned hand washing. Count 20 seconds, sing the happy birthday song, and wash your hands thoroughly. You'd
That's
be
right.
surprised how effective good hand washing can be in fighting any illness that's contagious.
Yeah, David, I want to talk about the reasons from your perspective that that we are not social distancing, especially in folks your age range. But before we get to that, there is a question. How can you tell the difference between body aches with COVID and any other kind of illness? And does apple cider vinegar or do apple cider vinegar or vitamins help? That's something that's not on our myth list tonight, but I'm glad it came up.
So the difference with body aches that are similar to the regular flu that you want to pay attention to. If you've ever had the flu, you know what body aches feel like. They're your not normal aches and pains of your knees. Your whole
Yeah.
body just hurts and you can't explain it. Those body aches you want to pay attention to. It doesn't necessarily mean that you have the virus, but you want to be astute to that and pay attention to that and pay attention to anything else associated with that. And I got to tell you about vinegar. My grandmother, God rest her soul, 97 years old, used to make us drink an ounce of vinegar every day. She would force it down us, an ounce of vinegar every day. And she said, you'll never get high blood pressure if you drink this. And I don't have it. So I'm not swearing by it. I'm just telling you my personal story with vinegar.
So you got to drink vinegar and we had to drink castor oil at my house every day.
Oh,
So
God.
I know, isn't that awful? So
Yes.
remember, walk at least 15 minutes every single day and 64 ounces of water a day. Gwen swears to you that that's not a lot of water, even though it sounds like an awful lot of water. But those things will help get your body in shape to help you fight this COVID virus. David, why don't you guys stay indoors? What's up with that?
First, I want to add to what you guys were just talking about the families. Like, I come from a precursor of diabetes and high blood pressure, and like Gwen said, drinking water and walking every day actually lowered my blood pressure to where I was off of medicine and my diabetes also. So
Wow.
taking like a holistic alternative approach from exercise and being active also are things that ensure that you stay healthy and be prepared for things like this.
Thanks so much for saying that. That reminds me, if I haven't said it already, please send your stories in to us tonight. Please send your experiences. Please send your questions. We really do want to make sure that we're telling you what it is you want to know tonight. And so, David, you don't get off the hook. So one of the things that we continue to see are people that are your age, that whole group of folks in our community not doing the things that Gwen said we should do in terms of, the social distancing piece, primarily the social distancing. Why are we not doing those things?
Well, I come from a generation of like almost renegade like mentalities. So where people think automatically these myths that exist are real. So they're making judgment off of the myths. They're saying things like, oh, it's 5G. I'm not worried about that. Let me stay away from the towers. Or they're saying, a lot of people were saying that they already had it, so they're okay. It's just like, not being considerate to their elders and youth and people who are actually being affected by this virus. They're not being considerate to them. They're saying, okay, I went out and I were okay. I was okay. I was with my friend. He doesn't have it. I don't have it. We're okay. They're not thinking about the the risk factors and being exposed in comparison to actually contracting the disease. This is the
Right.
same. You know, you can be asymptomatic. There's so many things about it my generation is just not grasping. And the idea of staying home is just like foreign, you know, like people, but it's so many things, you know, that you could be doing right now that you didn't have the luxury of doing that you could be doing right now. I
Like
feel,
what?
I've seen a lot of people in my generation getting interested in stock,
Hmm.
um, planning out. We don't usually have the luxury of getting a calendar and actually planning out our months and years. We don't it's things around the house, laundry, getting to know your
Right.
kids on a different level. That's something you have the opportunity to do right now. You know,
Right.
a
That's
lot of
exactly right. And for those of you who might be just joining us, I'd like to remind you that we're speaking to Gwen Gregory, who is the Director of Nursing at the Lucas County Health Department, and entrepreneur and influencer and artist David Ross. My name is Donnie Miller. There are reasons, though, that this virus spreads in our community faster than in other communities. Um, Other than the fact that guys are hanging out, women are hanging out, and they seem impervious. They think they're impervious to the disease. There are other reasons. There's a lot of discussion, and this is so really true about the density in our neighborhoods. You know, we are a community of folks. We raise our kids, we'll raise your kids. We people, you know, our parents, our relatives live with us. Lots of intermingling, lots of intergenerational contact in our communities. And that really makes it this sort of staying at home and not connecting is contraindicated to our culture. Wouldn't you agree, Gwen, David?
I do agree, Donnie, I do agree with that. And also accessibility to healthy and affordable foods.
Mm-hmm.
We're at a disadvantage culturally to
Mm-hmm.
have that access. And most Black workers have jobs that cannot be done from home.
I'm so glad you said that.
So
That's
they
right.
so they have to ride the bus maybe. Maybe
That's
they
right.
have to ride the bus to work and be exposed to how many people on the bus line. And then they have to work at a job, let's say a factory or a
Mm-hmm.
restaurant where they're in close proximity and they can't social distance.
Mm-hmm.
There's a lot of other factors that we need to consider with our culture. And I'd like to go back to that comment that David made about I've already had it, so I'm okay. That is not so. A
Right.
person could have very well had the virus, a mild case, let's say in January. You could have very well had a mild case, but coronavirus is a series of viruses. That doesn't immune you to
Right.
the rest of the other viruses. You may have had a mild case in January, but don't be fooled into thinking that you're immune because you're not.
And one of the one
David?
of the other thing oh go ahead. One of
Go
the
ahead,
other
David.
things is in our community, we have to depend on each other. A
Right.
lot of us don't have resources like some of the main things like food, water, shelter, comfort. So we depend on each other to actually get the essentials. And
Mhm.
that's where you at right now. I can't a person keeping distance is alone and isolated and may not have the luxury of taking care of themselves.
That's
So
right.
that's another thing that pops up, you know, in this situation.
That's right. Especially senior, and not just especially seniors, but seniors for sure. Seniors who are living in their houses alone, and they are isolated. They're not necessarily very savvy when it comes to technology. So, you know, our inclination is not to really let that happen. We want to go check on that person. We want to see about them. We want to make sure that they're doing well. However, there are ways to do that and still stay safe. Gwen talked about remaining at least 6 feet apart, um, wearing your mask if you are going to talk to somebody. All of those things are a great way to keep yourself safe and still be able to check on your neighbor if you have to do that. David, is there a particular mask? Is there something that we could get young folks to wear? There is talk about using bandanas, although I think Gwen would agree that they're not terribly effective, but it is something. Is there something that you can think of that might encourage people to wear masks?
Well,
Or is this just one of those things where they just have to bite the bullet?
no, I don't think no one should bite the bullet. I think being as an artist, I always say to myself to be creative and always think of a creative approach. And there's many different ways for you to create a mask if you don't have one. There's
Mm-hmm.
filters there's alternatives to filters that you can buy. Actual kitchen paper towel is not the microns to the dust of the virus are larger. I mean, aren't larger than the paper towel, but paper towel actually works effectively, almost just as much as a cloth mask. So
Huh.
if you use your cloth mask and put paper towel, a lining of paper towel behind it, I would imagine it would be more effective.
Hmm.
Just try something, be
Try
creative,
something.
utilize Google, utilize YouTube, try something. Just don't go without a mask, because I would only imagine that this wouldn't be as big of an issue if we were not making the contact that we were making, or having proper etiquette when coughing or when sneezing.
That's right. And Gwen told us about the importance of sneezing into the crook of your arm so that you are not spewing those droplets all over. I'm going to ask that we start to talk about some of the myths that are out there, because that's one of the things that has been really problematic. We started this conversation off in the wrong way, actually. We started this conversation off talking about this virus being one that happens when you travel. We talked about this virus being one that happens if you were older and you had an underlying condition. So a lot of folks didn't relate to that. It sounded like it was a disease that related to old white people who traveled a lot. And so a lot of myths sort of grew out of that. And we want to go through some of those tonight and push them aside. Let me tell you the primary one, and that's not the one that you see on your screen. The primary one is that Black folks cannot get coronavirus. Don't you believe that? That is absolutely not true. And David read those statistics to you earlier. You can see how many people in our community are dying from coronavirus. Let's put that myth back up on the screen again. And Gwen, would you walk us through that?
Okay, as far as the 5G mobile networks, that is the biggest myth. I don't know how that came to fruition, but that is totally not true. It is an airborne virus, but you can also be infected by touching inanimate, which is non-personable surfaces. Following the news, they found coronavirus 17 days after a cruise ship had been evacuated.
Mm-hmm.
17 days.
That's right.
So you can get it by touching surfaces. Please don't believe that. Once again, we have to go back to old-fashioned hand washing. If you're out, wear winter gloves if you don't have any other gloves to touch the grocery carts and that. Wear
Mm-hmm.
winter gloves. Wear something to cover your hands.
Mm-hmm. Absolutely. And one of the dirtiest things that we manage all day long is our telephone, our mobile phones. And so all of the advice is that we disinfect that phone, certainly not by putting it in water, but by wiping it with one of the Clorox wipes or Lysol wipes or something like that. Is that on? Yeah.
Yes, Clorox wipes, bleach. Bleach kills a lot of things. Old-fashioned bleach.
Right. It's really the point that you made about so many people in our neighborhoods not being able to remotely work remotely. is absolutely true. These people who were essentially ignored before, the bus drivers, the
Yeah.
taxi drivers, the folks in the grocery store, I mean, the list goes on, now are the ones that are keeping this world up. They are keeping us moving forward. They are, what can they do? They are out there all the time because they cannot stay home. There was a story just recently, and so many people saw it. It was so heartbreaking, about the bus driver in Detroit who
Oh,
died. Wasn't that awful? Who died
yes.
3 days, 4 days after putting a plea on Facebook that everybody cover their mouths and wear a mask, and cover their mouths when they talk or cough. I'm sorry. What can we do
I
if
wish
you're an
we,
essential, if you're a worker who can't stay home?
then you have to cover your mouth and nose. You have to cover your hands. You have to use hand sanitizer where there's not soap and water. Hand sanitizers that's at least 60% alcohol based or higher. You have to do that. Those are the only foolproof ways that can decrease your risk.
Yeah. And there is, those things are all important. David, though, there is a concern that we've heard an awful lot about, and I know this to be true, and Gwen knows this to be true, and I know you know this to be true, that Black men are hesitant to wear a mask, because of the possibility that it places them in harm. We've got that profiling issue that is always with us in the Black community. So the concern is that if you're walking into um, a business of some sort with a mask on, that you actually can put yourself at greater risk. Gwen is nodding her head. David, what do you think?
I think well, two parts, because I want to answer something you said before, but um I think that you have to just be cautious. I think you got to kind of use common sense. Like, if you're wearing your mask and your mask is black, don't wear a black hoodie. Maybe you can wear different colors. I know you shouldn't have to do these things, but it's the reality of that we live in. So just changing the colors you wear with your mask, or getting a mask with different patterns, more colorful patterns. Um, just being mindful that people are in fear,
Mm-hmm.
which is a responsibility the same way it is as if you're sneezing or coughing irresponsibly. You just kind of, like what you said, your question is, what do we do for essential workers? I think
Mm-hmm.
the thing is, we need to help each other. There's essential workers working and they're helping us. We need to try to help them. We need to figure out ways to create a system that works better, because people on their own are not helping and being responsible with their actions when it comes to COVID-19. And I feel like, the more we address the issue, the better the curve will be.
Right.
And you're
Absolutely.
correct. Unfortunately, profiling is not going to go away with coronavirus. So one thing I would recommend to African American men is to be a little more personable, to go out of your way. You can talk through your mask and you can say, hello, how you doing? And you can kind of try to allay any fears or profiling that someone may suspect if they see an African American guy with a mask on. If you are just a little more personal, that can help. That can help.
Right. That
You
can
can
really
talk
help.
to it.
And we really need to revisit this whole conversation about who we are in this community. I said when we started this conversation about a half an hour ago that this is a conversation this is an illness. This is a situation that finds its roots in racism. It finds its roots in structural racism, and that you can like it, you cannot like it. It is. It simply is that. There is a history in this country of putting people of color, putting poor people together in neighborhoods that are deteriorating neighborhoods, of not providing financial support to move out of those neighborhoods. There's a culture in our community and in communities of poor folk and brown folk, where we have become afraid of the police. And, we've got to have conversations with law enforcement officers about how frightening this situation is and how important it is that we all be involved in the discussion to save this community. And law enforcement officers have a really difficult job, and I would not want to live in a community without them. And so I don't want to leave the impression that they are not appreciated, but because that's simply not true. But additional conversation, talking about stuff, is always part of an effective pathway forward. So we need to have more of those conversations as well. The fact that we continue to be plagued by these illnesses, Gwen, is this something that we're just going to have to get used to?
At this point, we're going to have to continue to safeguard ourselves. We have to trust our leaders. We have to trust Dr. Amy Acton. We have to trust our governor. We have to trust our county and city officials. Everyone is doing their best because we really are in this together. And everyone's doing their best to combat this, but we need compliance.
Right.
And we need for people to understand that this is real. While we don't need to panic or incite panic, it's still real and it's still fatal, and it can hit home. I've lost a friend, 68 years old, as a result of the virus. Passed away at St. Luke's Hospital. So it's personal to me. It has really hit home. So what we have to do is continue to safeguard ourselves, and as much as we can, educate and bring awareness to the naysayers or those that minimize the seriousness of the disease.
Absolutely. There are folks out there too who have to use public transportation, and this conversation is for you. If you are walking, if you have to use public transportation, if you're riding in taxi cabs, if you are in places where it's difficult for you to find that 6 feet, Gwen, what would you say to them?
I would say to have your nose and your mouth covered, have your hands covered, because there are going to be situations if you need to ride the bus, maybe you can't distance yourself 6 feet away from the next person. The best thing you can do is protect yourself, cover your nose, cover your mouth, cover your hands.
Right, absolutely. Why don't we take a look at another one of those myths? And David, would you walk us through that one?
Frequent or excessive alcohol consumption can increase your risk of health problems.
Yeah, does go ahead, Gwen.
No, correct. Of a lot of health problems. Frequent consumption of alcohol can be deadly not only on your liver, but on your kidneys, on your heart, as it passes through every organ on a consistent and chronic basis.
And it doesn't protect you from the COVID virus, does it?
Not at all. Not at all. May make you feel like you're protected, but it doesn't.
Right. That's absolutely true. Let's take a look at another myth. And Gwen, would you walk us through that one?
The most common symptoms of COVID-19 are dry cough, tiredness, and fever. Some people may develop more severe forms of the disease, such as pneumonia. The best way to confirm if you have the virus producing COVID-19 disease is with a laboratory test. You cannot confirm it with this breathing exercise, which can be dangerous. The only way that you can confirm if you have the COVID virus is through laboratory testing. That is correct.
Right. There is this myth out there that if you hold your breath for 10 seconds, that you're protecting yourself from the disease.
You're not. If you hold your breath for 10 seconds, you're not expelling the virus. The virus is internal. So holding your breath is not going to do anything.
what they felt was the respiratory illness would take effect if you hold your breath for 10 seconds. You would wind up coughing if you had the virus. And a lot of people were like, "Oh, I'm good," and leaving out the house.
No, no. This is where we come in and bringing
Right,
awareness. We have to continue with bringing awareness and empowering people with the facts so that they're not delusioned with these type of myths, because there's no way holding your breath can do anything
right.
related to the
David,
virus.
what's the best way to get the message to folks out there in our community about these things that we're talking about tonight?
Well, I use the artistic approach because I'm an artist, and
Right,
artists make up a lot of the economy of Toledo and a lot of leadership and organizational leadership. So I use that approach, but I feel like as someone who advocates for community, I feel like this information should not be accessed through social media only. I feel like there should, we have to do a job of sharing the daily reports and making sure that elders and everyone is getting the same information from the same source. Whether if you have to take the update to your elder and show it to them and explain it to them, or have dialogue about the updates, the daily updates, because that's where the factual information will come from. Speculations and some of the memes and things that I see being shared is the biggest cause of the confusion, and they're going a long way. So myself and a lot of my friends and my area network, they share the daily updates from the mayor and from the governor, and we have those conversations. Those are important conversations. That's where you get the facts.
right.
And organizations, I feel too, a lot of organizations
Thank you.
need to be better about getting that information out to community.
You know
From
what?
official sources.
Right.
I'd like to add to that, David. I would like to see testing and triage centers set up in the African American churches. The
Hmm.
African American churches is a great resource. It's always been a building block to the community.
Hmm.
And we need to have more awareness through those venues.
Hmm.
Right now, we're conducting live stream services. I attend Friendship Baptist Church, and we're having everything live stream. We
Hmm.
take communion live stream. We go on Saturday, drive up, the deacons hand you your communion, you keep it. And then on Sunday, as the pastor is preaching, we are having even communion together via live stream. But everyone, well, not everyone, but a lot of us in our community and our culture, we trust our churches and our church leaders.
Hmm.
So let's use those resources that we have and trust to bring awareness.
It's absolutely true that if we don't get this message to the places where people who look like us are, that message is less effective in getting out there. That's
Absolutely.
absolutely right. One of the things, and this is a difficult conversation for our community, it has to do with taking care of our mental health during this time. Not just the things that you would expect, like cabin fever and your kids are making you crazy because they're in the house with you all day, but the fact that you are feeling anxious about this, the fact that you are feeling frightened about this. We are talking about this all the time, and there's a possibility that you can be here today and gone in 4 days. All of those things bring about a level of anxiety that has to be dealt with. But in our community, we are really slow to seek mental health consultation. Why do you think that is? David, Gwen, either one of you, why do you think that is? And what can we do about that?
I think we need to exercise better coping um, skills and just reaching out, as David said, we need to help each other. We need to continue to help each other. If I'm feeling anxious and I'm feeling stressed out, do I have a prayer partner or a friend that I can call that I
Hmm.
trust, that's not going to judge me for how I'm feeling.
Mm-hmm.
And I can be free to tell exactly how I'm feeling. My kids are getting on my nerves. I feel like knocking them upside the head. You want to be able to let that out to someone in a
Right.
non-judgmental way. And then they
Right.
can say, I know how you feel. Let's do this. How about I come over and let you have an hour of me time? Or let the kids go out in the backyard.
Right.
So
Right. Those are all great suggestions, David.
my suggestion is to use resources, like learn what's out there. Learn. There's many different people in the art sector that are giving out free programming. There's artists who are giving out free shows. There's places that are just saying, hey, if you want to talk, call this line. Check out the resources, because it's important. It's that important that you check out the resources that are available that can help you, and learn many different ways of expression, because expression goes a long way in these times where everyone is scared and afraid to admit it.
Right.
That's
Right.
something we should share together. I feel like,
Great comment.
it's in common. We have that one thing in common right now, that we all are in fear of what's next and what's now. So that conversation starter right there should be where we start healing from.
That's
Mhm.
exactly right. That is such a great comment. And that it is okay to be afraid right now. This is something to be scared about, frankly. The reality is, even though it's changing in some hospitals, the reality is if you get this and you get very, very sick, chances are you're going to die alone. That's a hard thing to say, but that is the reality. You are going to die alone. Most hospitals are not allowing, for obvious reasons, they're not allowing visitors in when people are have been diagnosed with COVID, or even if they're suspicious of having COVID and have been admitted to the hospital. They are limiting, and in most cases eliminating the opportunity to share that time with your family. There will be no homegoing, guys. There will be no
Yeah,
homegoing.
yeah.
If you
So
die from this disease right now, you don't get to get your family to be there with you and say goodbye to you with your friends and your family. There is no homegoing. You won't get to hug your people. You won't get to walk your daughters down the aisle at their weddings. This is serious stuff. This is very, very serious stuff. And we are working so hard to get this information out into this community. There are already enough things out here killing us. We really don't need to add this to the list of things, especially when there's something we can do about it. And I'm going to ask Gwen one more time to talk to us again about washing your hands and the other things that we
I'll say
can do.
one thing before you go move to the next
Yeah,
thing.
absolutely.
What you're saying to me is so important, because once we lose our family member, once our family member is in isolation in the hospital, we will want to be there with them. And once we lose them, we will miss them. So you got to think about right now, and in terms of enforcing these rules,
That's
enforcing
right.
stay at home, enforcing 6 feet distance. All of these things right now are small things to the picture that's out here, and that's COVID-19. So
Absolutely. And what are you doing that is worth your life?
right, absolutely.
What are you
Absolutely.
doing out there in the neighborhood with your boys or with your girls? What are you doing that's worth your life and worth the tears that your family is going to shed for you when you die, and they can't even be with you to say goodbye? I mean, think about that. Think about that. Gwen, remind us again what we can be doing. This is easy stuff, y'all. This is
Sure.
easy stuff to do.
Simple. Let's start with hand washing. Simple old-fashioned hand washing for a minimum of 20 seconds. Wash
Great.
your hands, wash your hands, wash your hands. We cannot wash our hands enough.
Right.
You can have symptoms anywhere from 2 to 14 days after exposure. So you have to trace back. Where have I been? Who have I been around? 2 to 14 days after exposure. There are those that tested positive that did not have any symptoms.
Mm-hmm.
Cover your mouth and your nose and your hands. When using hand sanitizer in situations where there isn't soap and water, make sure it is at least 60% alcohol based. At least read it. Make sure it's at least 60% alcohol based. Use gloves, winter gloves. You don't have to have surgical gloves. You can cover your mouth with a mask. You can cover your mouth with a shirt, but you need to have both your mouth and your nose both covered at the same time. If you have to go out, make sure you are covered. Evaluate, as you said earlier, what's more important? What are you risking your life for? Some people are just out here because they're restless.
That's
Do
right.
you really need to go to Walmart? Do you really need to go to the store? Make sure you try to load up when you go out once,
Right.
because that's very important. And
And
we have,
you do still get to walk outside, don't we, Gwen? We
yes,
still get to go for walks if we want to.
yes, yes, you can walk in your neighborhood, but it's very important to wash your hands, to cover your mouth, sneeze into the fold of your elbow. If you have to sneeze, if you have to cough, cover your mouth, cover your mouth and your nose and your hands. We have plenty of information on the Lucas County Health Department website under the coronavirus page. And I just want to go back to something here about masks. There is a myth that some people are out here thinking that they must have the N95 mask, and that's not so.
Mm-hmm.
As long as you are covering your mouth and nose, you are decreasing your risk. So
Mm-hmm.
don't feel as if, oh, I don't have an N95, I can't. No, you can, but you have to cover your mouth and your nose.
Mm-hmm.
And it doesn't have to be an N95 mask. People are making masks. Get creative. Put your favorite sports team on a mask. Just
Right.
get creative in how you do it, because this is the world that we're living in right now. And this
That's
is
right.
what we need to do to keep on living in this world. Symptoms: dry cough, fever, take your temperature, shortness of breath, difficulty breathing, muscle aches, nasal congestion, runny nose,
Mm-hmm.
diarrhea, sore throat, headache. Pay attention to that. It doesn't mean that you should panic. Oh, I got a sore throat, I have coronavirus. Not necessarily so, but that's something to pay attention to.
Right. And don't go to the emergency room first. Call your doctor
Oh, your
first.
doctor.
If you don't have a doctor, we're going to give you the numbers of two organizations that will see you if you don't have a doctor or if you can't pay. There are two organizations in town that are designed just for that purpose.
And if you have a question, there is a hotline that is staffed 24/7 with registered nurses. 291 5355. Area code 419 291 5355. It's staffed 24/7 with registered nurses. If you have a question, if you want to run by a myth, call that number. There is
Right.
a nurse that's going to answer the phone each time. It's staffed 24/7 with registered nurses.
Right. One of the things that we talked about, that's such good information, Gwen. Thank you so much for
Sure.
telling us that. We were talking about mental health, and David was saying that people should use resources. They should go out and take a look at what's out there, and we should recognize that we all have fear in common right now. David, how do we start that conversation with each other, especially with young Black men, without them walking away? How do we start that conversation about the importance of reaching out to somebody? Like Gwen said, you can just ask a friend if they can spend time and talk to you about it. But how do we start that conversation?
Well, community leaders and organizations that reach out to community need to work together and start addressing these issues, because COVID-19 is a disease that's affecting our community right now, but fear and lack of essentials has always been an issue in our community.
Absolutely.
And,
Absolutely.
and this right here just put the scope on it. So now we need to take this as an opportunity and start addressing these issues and working together. As I talked to a Mr. Vegas, and he said food, water, and shelter and comfort should be the focus of every organization that addresses community. And I
Mm-hmm.
agree with that. I feel like if we
Mhm.
work towards those things, we can eliminate a lot of issues that come beyond that. And people you use your phone for communication and social, but use it to learn things like holistic approaches, holistic alternatives, and stay healthy.
Mm-hmm.
Important.
Absolutely important. And part of this conversation, and I want to reiterate that there are lots of people in this community who are focused on this issue, lots of voices included in the development of our coming to you this evening. And all of us are saying the same sorts of things that David has just said, that what we're doing right now and getting this information out to you is really a phase one kind of thing. We are responding because we are in crisis right now. And we are trying to let folks know that they have some real responsibility in saving their lives. Because you know what? Nobody's coming to save you. Nobody ever has, and nobody is coming to save you now. It is on you. If you want to be here, you have to do the things that Gwen has mentioned. You have to listen to the things that David has said. Those are the things that will get you through this very difficult time. But we know that this is just a phase one. If if we are going to be around for the length of time that we want to be around on this planet, we know that we have to begin addressing these issues in a long-term fashion. Like I mentioned to you earlier, Van Jones said, we are just laying one pandemic on a whole lot of already broken system pieces that affect people of color. So we have got to be better advocates for ourselves, y'all. We have got to
Yes.
talk about what we need, and we have got to demand that it be on an agenda that is looked at by people who have the power to make that agenda happen. And the first person that has the power to make sure that these issues are being paid attention to is you. Use your voice, save yourself. That is so important. We anticipate this being a long-term discussion about the social and structural inequities that face people of color, that face poor people in not just this community, but in this world. So we really hope that as we move forward, we can depend on your voice to be part of that conversation. Let me say it again, save yourself. Save yourself. Do the things that Gwen is talking to you about and that David has talked to you about. It's your responsibility. Absolutely. I want to mention that the myths that we are showing you today are actually part of the Lucas County Health Department's webpage. That's a great, great webpage. Lots of good information on that webpage. And I'm going to ask if we can show another myth that Gwen will walk us through.
Okay, I see no here. Is there a question? Vaccines against pneumonia, such as the pneumococcal vaccine and the Haemophilus influenza type B, the HIP vaccine, do not provide protection against the new coronavirus. Very, very true. The pneumococcal vaccine provides protection against pneumonia. The HIP, the Haemophilus influenza B vaccine, provides protection against that disease only. There is not a vaccine developed yet that will protect you against corona. If you are diagnosed and you are positive, the best thing that you can do, if you are not hospitalized, is to quarantine yourself. Quarantine means to totally isolate yourself, your eating utensils, into one specific area of your living quarters. One room, bedroom, basement, and stay there for 14 days. Stay there until you are afebrile, which means you do not have a fever for at least 72 hours or 3 days.
That's right. Again, somebody is asking if there's a 24-hour hotline. Gwen, do you want to talk about that one more time?
Yes, there is a 24-hour hotline. Thank you for asking. It's staffed with registered nurses, and the number again is 419-291-5355. And those numbers are on the Lucas County Health Department's webpage as well under the coronavirus section. Once again, 419-291-5355. Also, 419-251-4000. Both lines are staffed 24/7 with registered nurses, ready to take your calls and questions.
Thank you so much for that. I want to just do a few more things, and then we're going to leave you for this conversation. But again, there are others to come, and we're going to talk about that just a little bit before we go this evening. But we're talking an awful lot about the nose, covering the nose and the mouth. What about covering the eyes, Gwen? Covering the eyes, I'm sorry. Of course you can't cover your eyes. Can you get the virus through your eyes?
No, you cannot. Now, your eyes contain body fluids, so I can understand the concern and the rationale. But until someone is actually diagnosed and that is proven, I will give it a firm no. You cannot contract the virus through your eyes.
All right. And I want to ask this one question about gloves. And then, David, I'm going to ask you what you would like to leave folks with who are listening to us tonight. So the question, Gwen, is about wearing gloves. Some people are not wearing gloves because they're afraid of what's being called cross-contamination. I think what they mean is that they will pick something up on the glove and then transfer it to themselves.
So if you are going into a store, Walmart or Kroger's, they have the disinfecting wipes. You can wipe your gloves. You can use hand sanitizer on your gloves. Let it dry and keep using it to touch other items.
Right, and that's right. And the additionally, the wisdom is that once you take your gloves off, you should wash your hands. I know
Correct.
that we've said this. I know that we've said this a lot, but you would be amazed at how much contamination you can keep down from washing your hands. Gwen, is that right?
That is totally correct. Absolutely. Good old-fashioned hand washing for a minimum of 20 seconds will decrease the spread of disease significantly. Just by washing your hands over and over again, you cannot wash your hands too much.
Right, absolutely.
You don't want to do it too soon. You want to make sure you get 20 seconds in.
Right.
5 seconds of washing your hands, you've not done anything. So you want to make sure it's 20 seconds at least.
Does it have to be warm water? Can it be cold water?
Oh, it should be at least warm water.
Should be warm water.
Yeah.
Okay. Okay, so David, as we close out this evening, what would you leave people with?
I would like to say, check out our website at the Toledo-Arts-Commission.org. We have a lot of resources for artists, and artists make up a lot of jobs in Toledo. And also, if you're going through mental health issues, or you just want to be heard, or you want someone to just listen to you, next week, the 22nd, we're having a peace circle live via Zoom. So you can look out on my Facebook, or look me up, David Ross, on Facebook, and I'll link you all to that Zoom once it's set up. We will be listening to people sharing stories and just kind of just being ears to one another, just something to get a peaceful conversation going.
Great, thank you so much. Gwen, I have one final question that just came up, and someone would like for you to address this question before we leave tonight. There's all of this discussion about whether once you've had it, you've developed the antibodies that will keep you from getting it again. What's the common thought about that?
The factual thought about that is you can develop antibodies to one form of the virus, but let's remember that the coronavirus is a series of viruses. That doesn't give you total immunity at all.
Mm-hmm. Okay. And what would you like to leave people with this evening?
I would like to leave people with the awareness and truth that this is serious. And I hope people learn to take it serious, that we need to wash our hands. We need to cover our nose and mouth. We need to cover our hands. We need to stay home and fight the restlessness that's going on, and only go out in public when you absolutely have to. And I also would like to have everyone reach out to a church, because I want to see more involvement with the churches, because the churches is a very good venue and a trusted resource that people will listen to, that we can spread the awareness and the facts regarding coronavirus to our culture and to other people. Listen, pay attention. We're just at the beginning. It's not going anywhere anytime soon. We all have a different way of living from now on. And I don't know when that on will end, if it does. I just want people to take it serious, not panic, but take it serious and
Take it seriously.
use the stated precautions. Trust leadership. Trust what you are being told by Dr. Amy Acton and Governor DeWine. Trust that to be true.
Absolutely right. So I would just like to remind you all that there will not be a stronger advocate than you when it comes to your health. And you have to own this. You have to own responsibility for taking care of yourself in this process. You have to do the things that David has talked to you about. Listen to him. He's a smart man, and he's told you some really important things. And you have to listen to the things that Gwen has said to you today. She knows this science. She knows this science. This is the way, this is what she does for her life. So she knows what she's talking about. You have to be your own advocate. We can win this. We are warriors. We have always been warriors. Now is not the time to stop that fight. I'm going to ask if Sarah would put up the slides again for the resources, if Gwen would walk us through those. There's hotlines. Oh, I can do this one. If you need a doctor, and if you think that you cannot afford to pay, please, please, please don't let that be a problem for you. There are 2 organizations in town that are federally qualified health centers. Both those organizations are required to see you regardless of your ability to pay. High quality care given at both of these sites, and would be really, really happy to see you and be your partner as you move through this process. Neighborhood Health Association, that's the place where I work, that the phone number there is 419-241-5700. Just a shout out to that organization as it celebrates its 50th year of service to this community and the folks out there who are within the sound of my voice. And Health Partners of Western Ohio, you can reach them at 833-691-4015. You will not be turned away because you cannot pay. I'd like to revisit the hotline numbers again, Sarah, if we can put those back up. There you go. Those numbers are 24/7 nurse informational hotline. Gwen has mentioned these several times. Please pay attention. 419-251-4000, 419-291-5355. If you didn't have a pencil to write those things down, These will be posted. This session is being recorded. You'll be able to get them after the end of our time together tonight. And there's one more slide I would like to show you. There it is. For COVID-19 emotional support, please take a look at that number, 419-442-0580. There's a crisis hotline there for you as well. You see that number. Supporting local heroes. This is so cool, and this is so important to do. There are people out there who are on the front lines every single day, taking care of the people that we love and the people who love us. If you want to be a part in telling them how much they mean to you, call that number in front of you, 419-841-6781. And mental health services, we have lots and lots of terrific mental health services in town. This is one of them, the Zeph Center at 419-841-7701. All right. It's been a joy. It's been a joy and an honor to be with you this evening. And we want you to come back to more of these community conversations. The next one is scheduled for April 23rd from 6 o'clock to 7:30. It's on the Toledo-Lucas County. It will be on the Toledo-Lucas County Facebook Live. It is that kind of event. And we're talking about the economic impact of COVID on the Black community. Panelists, take a look at that. I will be moderating that time with you again. Ms. Saunders will be there, Tonia Saunders, Kathy Tucker, and Shalonda Jones. All will be there to talk to you about this really important subject. You guys, thank you so much for spending this evening with me and us. We so appreciate it. You go out there, you be safe. It's important. Talk to you soon.
Thank you.
screen now.
Would it be a major point for transmission if somebody has, like, for example, say they have like glaucoma, like you have, you know,